Hello. While my laptop is being dumb, I'm going to teach you guys how to do catheterization. Now, don't mind my mask. I may be sick, but at least you can't get virtually sick. Because if I virtually cough on you, well, maybe it'll spread. I don't know. Oh, look. So we're going to go over indwelling and straight cath, or as some people like to say, they're fancy, intermittent cathing. Oh my god. Okay, so first, know the difference. Can you tell me what's the difference? Good, thank you. Anyway, difference is indwelling. There's going to be a gravity bag that we're going to put on the side of the bed because it's long term. Sorry if you can't understand my voice. I'm just going through puberty right now, even though I'm 23. And then the second one, straight cath, we're just literally trying to collect some sterilized urine for the lab people because they love it when we send them really good piss. Okay. Difference. Okay, great. So when we go in the room, do your aidet. Hi, my name is Kenny Urina. I'm a student nurse. Wash my hands. Right, you washed your hands. Make sure it's the right patient because I don't know about you, but if somebody mistakenly put a catheter inside my urethra even though I didn't need it, I would kind of be pissed. So make sure it's the right patient. You know, what's your name, date of birth, verify it with their, little hospital bracelet, And then after that, you're going to explain to them what's happening, give them a 10-minute minute. Hi, I'm putting a tube up your urethra. We're going to collect some urine, or we're just going to leave this long term. It'll take about 10-15 minutes. Any questions? Great, Fred. Next, make sure you have all your materials with you. Okay, make sure you have your kit. Make sure you have your gloves, your sterile gloves. Make sure you also clean them beforehand. So put on some regular gloves. Take some soap and water and a rag, and maybe place like a little pad underneath a waterproof pad and clean them up. Great, cool, good job. You're doing great. Oh my god, your preceptor would be so proud of you. Then after that, we're gonna first put on a if I can think. Then when you open up your kit, there's gonna be a little drape. Well, it's not little. It's just a drape. Take that drape. There's gonna be a shiny side and a non-shiny side. This isn't the drape, but I don't have one, so bear with me. Take the shiny side, that's gonna be the bottom. So the top one, the non-shiny side, you're gonna place it underneath the patient, right? And the patient, because we're going in there, right? We're going in there, right? So just like have their legs spread apart and maybe like bent, and just like put that pad underneath. Make sure it's good underneath because we don't want anything going anywhere. Because trust me, I don't want to go back to sleep with a whole bunch of filth all over my private areas. The patient doesn't. Neither would you. So don't. So we're gonna do that. We're gonna place it. Then we're gonna put on our stupid gloves because God forbid we put the fenestrated drape without our sterile gloves. So we're gonna take our sterile glove pack. We're gonna open it away from your body, please, for the love of God. Just open it away. We're gonna be as sterile as we can. Make sure you wash your hands again after you clean the patient, even though you had gloves, please, for the love of God. At this point, we're gonna start doing sterile techniques. So don't touch your hair. Make sure you fix it beforehand. Get those bangs out of the way, okay? You need to text your boob, better have done so beforehand because we ain't texting him back at this point. Okay, so we're gonna open it up, right? And this is gonna be the bedside tray. We're gonna have our kit, we're gonna have our gloves. We're just gonna set it down, okay? Okay, you're with me so far? Right? And we're just gonna open this one first. And I just like bending it because if the flap opens back on the glove, that's breaking aseptic technique. So we're just gonna bend it kind of like this. Okay. With me so far? Are you with me? Fred, are you with me? You don't need to do CPR on you, right? You're alive, right? Okay, cool. Good. Because I'm not doing CPR on you. Then next, we're gonna open them up with our hands. I only have one hand, so I can only do it one at a time. So just kind of like do that because of that. I don't want it to bend back, okay? I don't want to because that breaks aseptic techniques and sterile technique. And I'm not grabbing another pair of gloves. I'm not grabbing another one. Then we're gonna grab our dominant one first, okay, and then our non-dominant one. So our dominant one, we're just gonna like put our hands inside, right? Right? And we're gonna make sure we try not to touch it as much as possible because that just is not good for our gloves and the patient and a UTI. So we're just see how I'm just like barely like just right. I'm not touching this. This I can touch because it's underneath the glove. Just leave it alone. Just leave it alone. Next, we're gonna grab the other one. We're just, oh my God. We're just gonna put, look, like, see how I did this? Oh my God. Make sure your thumb, you know where your thumb is because that's gonna be where you're gonna F up real good, right? That's where you're gonna break your technique, right? Then you're gonna take your hand and you're just gonna see how easy that was and just, you know, if that makes, you know, okay. Ta-da! And just take it. Don't throw it on the ground. I was told don't throw it on the ground because I don't know why. I like throwing it on the ground for dramatic effect, but I wouldn't because probably people won't like that. Then you're gonna grab your kit. It's gonna be something like, probably not like this. I don't know why I did that. Okay, when we open it, be careful because you're gonna break something. You're gonna break your sterile technique. Okay, just be careful. Okay. At this point, because we have gloves, we're not gonna touch anything. We're gonna follow our 1-inch border rule, and just keep your hands above because we don't want them below the waist. Keep it away from your face because we don't want any droplets getting on the fucking glove. Okay. So we're just gonna do that. And next, we're gonna take this and we're just gonna outside because if we put our arm over something, we're also breaking sterile technique. See how fun this is? Then we're just gonna open it, right? We opened it. Great. It's gonna come with some things. It's gonna come with some gloves. It's gonna come with some gloves. We already put on our sterile gloves, so we don't need that. If you're doing a indwelling cath, maybe you should have some tape so you can tape the catheter to their leg so it doesn't go anywhere. It's probably gonna come with something to clean them with. It's probably betadine. Make sure you ask them if they have latex or iodine allergies because we don't want our patient to start having a swollen throat and not breathe because that's one less problem we do not need on top of trying to get a UA. So you're gonna take your tray. You're gonna put it right next to the patient's private area, either penis or vagina. I don't know why I just tried to censor. I don't even know anymore. Right. Okay. It's either gonna be 3 swabs if it's for the betadine, or it's gonna be like a liquid and you pour it in a little cup and you take 3 little cotton balls and you just take your little thing you grab it with and you just dab, right? When you clean it for a penis, from the top of the penis, you know, the top, You're gonna clean the top and down the shaft. You with me so far? For a girl, you're gonna do the furthest labia minor away from you. So for me, if I'm on the patient's right side of the bed, right, I'm gonna clean their left labia minor. Oh look, my computer decided to turn on. Thank you. So you're gonna clean their, the furthest labia minor, then the one closest to you, and then you're gonna clean the middle where the urethra is, right? And make sure when you do it, when it's a girl specifically, when you do the middle part, when you're cleaning the urethra, you open it up, and at this point, there's gonna be one hand that's gonna be dirty, and it's not gonna be sterile. Don't touch anything with it. Whatever you're holding the penis, because you have to hold the penis, or you're opening up to see the urethra when you clean it, that's your non-sterile hand. Okay, so just don't let it go anywhere. So we're gonna open it up, and then we're gonna clean, and then leave it like that. Leave it open, because if we close it, and the urethra is not exposed anymore, guess what that's breaking? I'll give you a second. Sterile technique. That's what you're breaking. You're breaking sterile technique, so just leave it open. Just leave it open. Okay, just leave it open. Then you're gonna grab your catheter. I don't have a catheter because I don't have to do catheters on myself at home. Thank God. So I'm gonna use this. Okay. For women, we're gonna lube this 5 to 7 inches. Sorry, that's a guy. Sorry, for male, we're gonna lube this 5 to 7 inches. A girl, we're gonna lube this 1 to 2 inches. Okay. So you're gonna lube it with your sterile hand, or you could always just have it pre-lubed and just put it in the container. So you're gonna have everything right there. The less you move, the better, okay? So, when that's lubed up, if it's a straight cath, we're gonna take it, right? If it's a penis and it's a straight cath, we're just gonna literally just shove it all the way in there, past that bifurcation. Okay, we're just gonna shove that whole tube up there. We're just shoving it up all the way up there. I think. I'm not really sure. No. And then if it's an indwelling and a male, because they have a penis, you're gonna shove it in there 7 to 9 inches, or until you see some urine, right? If it's a female and we're doing a straight cath, we're gonna shove it in there 2 to 3 inches, or until we see some urine, right? So we're just collecting some urine, right? If it's an indwelling, we're gonna shove it in there 2 to 3 inches. When we see some urine, we're gonna shove it in there another 2 inches, just to make sure, because we're blowing up a balloon with the indwelling. Right, so we did that. Oh my gosh, awesome. Then you're gonna take your balloon for indwelling. You're gonna have your syringe with the sterile water. Please don't fill it up with normal saline. Please, for the love of God. You're gonna, some crystals are gonna form. The patient's gonna be bleeding, and somebody's not gonna be happy. So I don't know about you if I'm bleeding out of my penis because somebody put normal saline in a balloon that caused some crystallization of my catheter. I wouldn't be happy, nor would I be happy trying to have that taken out. I don't think anybody would. So you're gonna take the indwelling catheter, you're gonna take the syringe, you're gonna blow the solution in slowly until everything's in there. Usually the catheter tells you how much water to put in there. Just follow that. Just follow it. Then when you're done filling it, take your catheter, and we're gonna make sure it's properly paced. We're just gonna pull it until it's actually like, oh my gosh, I can't pull anymore. That's when you know it worked. Like, good job. That's for indwelling cath. We want that thing to be placed just secure, okay? For straight cath, you start seeing some urine. You're gonna have your cup, okay? You're gonna have your cup in that kit that's right next to their whatever they have, a penis, vagina, or in between. And when we put that in there, you're just gonna take the cath and just let that drip in there until you collect enough urine. Then you're gonna take the cup, take it out because everything's dripping inside the kit now. You're just gonna let it drip until it's done dripping, and then you're gonna take it out. Now, to make sure we follow a sterile technique, when you're putting the cath in the urethra, for the love of God, this is your sterile hand, this is your non-sterile hand, right? Because I'm holding the penis with this, right? Or opening up their urethra with this. Or now, exposing their urethra, yeah. Right? Do not let this touch anything, okay? Don't let this, while you're putting in there, touch their penis or vagina or urethra or anything in between. Just don't. Like, we're just gonna like, ooh, okay. Ooh, okay. Also, if you can't push the cath, first of all, do not force it. Just wiggle it, twist it, do whatever. But don't pull it out and then put it back in. If you pull it out, it's not sterile anymore. And then when you push it back in, hopefully they don't have a UTI, and that's going to be an extra set of labs and medication for you to do. So I'm saving you some trouble, not the patient. Okay, nope, just twist it and just keep trying, and just don't pull it out and put it back in. Just don't. Okay. And basically you're done with the straight cath. For the indwelling, when you throw everything away, make sure you take the gravity bag, just clip it to the side of the bed, make sure it's actually dripping, make sure it's below the patient's waistline so we can actually have gravity drip that urine in there. Go whoosh. You know, we want that in there. Okay, we want that in there. We want the urine in there. Okay, INO, can't have INO unless you got that gravity. So INOG. Anyway, then you take off your gloves. Maybe you would want to clean the patient because they probably have a whole bunch of lube and iodine on them. Maybe, up to you, I don't know. You have to clean it eventually, so might as well clean it now, haha, because you're the nurse, or in this case, the student nurse, or your preceptor will make you because they don't want to do it. So at this point, clean it, throw everything away. How's everything doing, Fred? Are you okay? Are you feeling anything? Are you feeling any pain? Make sure that they're okay. Make sure that they're alive. Make sure they're not having any reactions to the betadine or latex. Okay. And then after that, the most important part, can you guess what it is? I'll give you a hint. Has to do with typing. I'll let you think about it. Yes, you're right. Oh my gosh. How'd you know? Document it. Because if you didn't document it, then it never happened. And then somebody's going to put in another catheter in there, even though there's already a catheter. And then there's going to be 2 catheters. Look, I don't know. Just document it, okay? And then make sure maybe you want to, like, for the catheter that's indwelling, maybe you want to put, like, when it was inserted. Like, they might have some labels on it. So just date it, sign it, time it, initial it, put what type it is, etc., etc. Oh, and don't forget, look, I also forgot, tape that catheter to that leg so it doesn't go anywhere and rip out, and then there's urine all over your bed that you're gonna clean. Yeah, just tape it. just tape it. They might not like it when you rip off the tape if they have hair, but no shave November. More like you should have shaved November because you're getting a catheter. Well, they probably didn't know they're getting a catheter, but they probably should not have done no shave November, even though we're in September. I don't know why I thought about that. I thought it was October already. I'm just excited for Halloween. Anyway, that is it for this week's catheterization cath. I don't know anymore. I'm sick. I'm tired. My throat's bleeding. My nose is plugged. I'm not going through puberty. If you thought I was being for real in the beginning of the video, I'm over 18. Duh. Anyway, hopefully that helped y'all out. Good luck. Don't break your aseptic techniques and your sterile techniques if you do. Throw everything into the trash. Scream internally and do it again. I don't have anything else for you. Have a good one. Bye.